These muscles are very hardworking, whether they are nursing babies postpartum or whether they are just carrying around larger breasts during pregnancy. I move the head this way, I rotate it, I slide my hand underneath, and then as I lift my hand up, I rotate the face towards the side that I'm massaging. And I'll do that again. I rotate the face away, I run my hand under, so it's a palmar grasp underneath the cervical area, and I lift and rotate it back. It's one of my very favorite strokes from about 40 years ago, and I just love it when somebody can do this on me. And remember to have that lift as you're coming back. So you lift up, so it isn't just like this, but there's an extra lift and rotate. How's that, Lisa?
Oh, it's wonderful.
And as you're coming across the throat, be careful not to get too much of your heel. So I just let go like that as I'm coming across. But I do rotate her right over. And then I just waltz around to the other side, and I would come up and lift and twist. Neck twist sounds pretty gruesome, but it feels wonderful. And we just lift and rotate, and then press out again to the pecs, and loop around and lift and twist. So you could probably do about 2 hours of this.
At least.
And, yeah. And they would certainly appreciate it at any point in the pregnancy, labor and delivery, or especially postpartum. There you go. Thanks, Lisa.